ISOKINETIC strength profile of female soccer players between limb comparisons. As highlighted in the critical review by Barr in 2016, it is very difficult for any test to identify at-risk athletes for injury. Nevertheless, it is important for biomechanists and sports medicine practitioners to have a batch of assessments to provide an injury risk profile of the athlete. For example, an assessment of a range of modifiable risk factors associated with a specific sports injury to identify deficits with athletes to target in training. Low ISOKINETIC knee flexor strength and reciprocal knee joint muscle balance are two such factors that have been associated with non-contact anterior cruciate ligament injury in female athletes, suggesting the use of ISOKINETIC assessment when injury risk profiling female athletes. Generating normative ISOKINETIC strength data is important, therefore, in order to identify deficits in players during injury profiling. However, often in such studies, reciprocal knee joint muscle balance ratios reported use peak moments from different angles in the calculation and do not consider the muscle balance as specific regions of knee flexion range of motion. Non-contact ACL injuries in female soccer commonly occur during change of direction actions. Thus, consideration of angle-specific muscle balance may be more prudent, given that non-contact ACL injuries typically occur in the first 17 to 50 milliseconds of ground contact of landing and change of direction maneuvers, and at 5 to 30 degrees of knee flexion. Poor hamstring co-contraction strength in this region may place the ACL vulnerable to elevated anterior shear forces from the quadriceps. Non-contact ACL injury patterns in soccer players have also been shown to differ between sexes in regard to limb preference, with the majority of injuries in female soccer players occurring with a non-preferred kicking limb and a reverse pattern in males. Limited literature has examined whether limb preference influences bilateral and reciprocal knee joint muscle balance in female soccer players, particularly throughout knee joint range of motion. Examining bilateral muscle balance with the limb close to full knee extension may help provide information to identify whether muscle imbalances exist at critical regions of joint position. Therefore, the aim of this study was to provide an ISOKINETIC strength profile of female soccer players and examine whether limb preference influences bilateral and reciprocal knee joint muscle balance. So for this study, 25 female soccer players from the second tier of English women's soccer participated in the study. 23 of the players preferred to kick a ball with the right leg, whereas 2 favoured the left. All players were free from injury at the time of the study, and none had suffered any prior traumatic knee injury. Concentric knee-centric moment angle profiles were collected for the right and left knee extensors and flexors at 60 degrees per second using a King-Com ISOKINETIC dynamometer. Each subject was seated and strapped in with the hip joint flexed to 90 degrees. The axis of rotation of the dynamometer shaft was aligned to the best approximation of the knee joint axis of rotation. The cuff of the dynamometer lever arm was attached just above the ankle. Knee joint range of motion was set as close to 90 degrees as possible, 0 degrees equaling full knee extension. The anatomical zero position was standardized for each subject using a spirit level before setting each subject's range of motion relative to this position. Following a warm-up, each player performed 4 maximal repetitions each of concentric-eccentric knee extensors, followed by eccentric-concentric knee flexors. The order of each limb was counterbalanced across subjects. The weight of the limb was taken at 20 degrees of knee flexion and subsequently used to gravity correct the moment readings. Data were exported in ASCII format into Microsoft Excel for analysis. Each profile was inspected to ensure peak and angle-specific moments were established within ISOKINETIC range with a tolerance of 1 degree per second. The obtained peak moments for each muscle group in each mode were used to explore bilateral asymmetry. Asymmetry due to kicking limb preference was determined as a raw difference and using the formula as stated on the slide, whereas absolute asymmetry was defined as a raw difference between the strongest and weakest limbs and using the formula as stated on the slide. The strong limb being the one with the highest peak moment for a given muscle group and mode. Traditional and dynamic control peak moment ratios were also determined. Moments at 30, 40 and 50 degrees were determined for concentric and eccentric knee flexors and concentric knee extensors to determine angle-specific traditional and dynamic control ratios. Finally, using the eccentric knee flexor and concentric knee extensor moment angle curves, a dynamic control profile which represents the net joint moment throughout the full range of motion was created for each subject in each mode. The point at which the net joint moment corresponds to 0 is defined as the angle of crossover, which was subsequently determined for each player. The angle of crossover indicates the range for full extension whereby the knee flexors eccentrically are stronger than the knee extensors concentrically. All statistical analysis was conducted in SPSS for Windows or Microsoft Excel. Normality was confirmed for all variables via a Shapiro-Wilks test. Therefore, peak moments, paired t-tests and Cohen's d effect sizes were used to compare between preferred and non-preferred limbs and strong and weak limbs. For reciprocal muscle balance, comparisons were made between preferred and non-preferred limbs using paired t-tests and Cohen's d effect sizes. Finally, bilateral comparisons were made for each muscle group in each mode across the entire isokinetic range using paired samples t-tests and Cohen's d effect sizes. P-values were Bonferroni corrected for adjacent multiple pairwise comparisons. Significance for all tests was set as P less than 0.05 and all effect sizes interpreted using a Hopkins criteria. So results. Table 1 shows peak and raw and percentage differences in moments for each muscle group in each mode between preferred and non-preferred limbs and the strongest and weakest limbs. What you can see in the bottom half of the table is that there were significant, mostly moderate differences in peak moments between strong and weak limbs observed. In the top half of the table, you can see non-significant small differences revealed between preferred and non-preferred limbs for the eccentric knee extensor peak moment, whilst all other peak moment values revealed trivial differences between preferred and non-preferred limbs. In regard to reciprocal muscle balance, there was no significant small differences revealed for the traditional dynamic control ratio and angle of crossover between preferred and non-preferred limbs. A significant small difference was observed between preferred and non-preferred limbs for the traditional ratio at 50 degrees, but at 30 and 40 degrees, non-significant and small differences were observed between preferred and non-preferred limbs. Finally, dynamic control ratios at 30, 40 and 50 degrees revealed non-significant trivial to small differences between preferred and non-preferred limbs. In regard to moment angle profiles, there was non-significant trivial to small differences observed within the available isokinetic range between preferred and non-preferred limbs for concentric and eccentric knee extensors and eccentric knee flexors, whilst trivial to moderate differences were observed for concentric knee flexors. Again, these were all non-significant. Collectively, the results suggest that limb preference has only a small effect on bilateral and reciprocal knee joint muscle balance. Thus, any trend towards higher risk for the non-preferred limb in female soccer players is unlikely to be due to strength differences between preferred and non-preferred limbs. Given the observed presence of bilateral imbalances when comparing strong and weak limbs, suggests that this approach should be used to explore bilateral asymmetry on an individual basis during injury risk profiling. For instance, the following is based on the mean plus standard deviation strong versus weak comparisons for each muscle group in each mode. Thus, if a female player exceeds these values in absolute, relative or percentage terms, they could then be identified as having high and possibly problematic asymmetry for injury risk profiling or return to play criteria. Absolute and relative peak moment values for concentric knee extensions were similar to data on elite female soccer players at 60 degrees per second. However, absolute and relative peak moment values for concentric knee flexors were slightly lower than previously reported for elite female soccer players, which would suggest a concern for this cohort of player. Furthermore, relative peak moments for concentric knee flexors and extensors were lower than values reported for professional male soccer players. No significant regional differences were observed bilaterally, particularly at low knee flexion angles of 30 degrees or less. Also, in comparison to literature by Graham Smith et al. In 2013, there were a respectable angle of crossover and dynamic control ratios at 30 degrees observed, which suggests sufficient hamstring strength in relation to the reciprocal quadriceps in this region of 30 degrees or less. Thus, it would appear that regional specific bilateral and reciprocal strength deficits may not be a concern for female soccer players. The generally low absolute and relative peak moment values, particularly for the knee flexors, are likely to be of greater concern and highlight the need to develop strength with female players to allow them to be more resilient for the change direction demands associated with soccer. To conclude, limb preference only has small effects on muscle strength asymmetry and reciprocal muscle balance ratios. However, it is likely that global knee extensor and flexor strength deficits are an important consideration for injury mitigation in female soccer players rather than focusing on regional specific strength deficits.